The cardiac cycle is vital to the circulatory system's regular function, and it is pivotal in the transport of the blood medium to exchange surfaces. Without this mechanism, you wouldn't be able to deliver oxygen to respiring tissues or remove waste products such as CO2, hence it is important to maintaining life. It is an intricate process, so it must be carefully regulated. One small error could trigger severe health consequences. The general process begins in the silent atrial node present in the right atrium. This tissue, also often referred to as the natural pacemaker, is responsible for regulating the timing of the cardiac cycle. The silent atrial node has the ability to create electrical current by the process of action potential, in which the membrane potential, or the difference in the electrical charges between the interior and exterior membranes of the silent atrial node, are rapidly changed. This sends an electrical signal that stimulates the first stage of the cardiac cycle, diastole. Diastole, from the Greek for separation, is a relaxation of the ventricular and atrial walls. This allows the flow of blood into the chambers of the heart. This process is followed by atrial systole, in which the atrial walls contract, causing a pressure gradient that moves further blood into the ventricles. A brief pause in the cardiac cycle occurs. This is to allow the movement of the blood in the atria into the ventricles. Finally, the ventricles contract, pushing blood into the arteries. This process repeats, allowing for the continuous flow of the blood medium. This process on average is performed between 60 to 100 times per minute. To prevent the backflow of blood in the heart, 3 types of valves, the mitral, bicuspid, and the semilunar valves, are present. During diastole, the mitral and bicuspid valves, together comprising the atrioventricular valves, remain open, whilst the 2 semilunar valves remain closed. During ventricular systole, the atrioventricular valves close to prevent blood flowing back into the atria from the ventricles, whilst the semilunar valves remain open, allowing blood to be pumped. The cardiac cycle is adapted to use pressure to pump blood, and so the pressure in the chambers is variable in the cycle. Ventricular pressure begins low, but during ventricular contraction during systole, the pressure rapidly increases until pressure begins to fall again during diastole. Ventricular volume rises during atrial systole, as blood is flowed into the ventricles, and falls during ventricular systole, as blood in the ventricles is pumped out. Atrial pressure is relatively low, as they cannot withstand much force due to their thin muscular walls. Pressure is highest whilst contracting. Aortic pressure rises during ventricular systole, as blood is moved into the aorta. This then gradually falls as blood is moved through the aorta. However, the electrical signals are not just important in coordinating the heart, they also serve as a powerful medical diagnostic tool. The electrocardiogram, or ECG, is a medical tool that detects the electrical signals emitted by the silent atrial node using electrodes placed on the chest of a patient. This allows the display of the rhythms of the patient's heart on a monitor, allowing use as a diagnostic. A regular heartbeat has 3 distinguishable stages: the P wave, which is emitted during atrial systole, the QRS complex, which is emitted during ventricular systole, and the T wave emitted during ventricular diastole. However, heart conditions can affect electrocardiograms. Tachycardia is a heart rate above 100 and can be seen by a large number of peaks. The inverse, brachycardia, is a heart rate below 60, in which the ECGs will have fewer peaks. A fibrillated or arrhythmic heartbeat will have an irregular rhythm.